No doubt we'd all appreciate COVID quickly becoming one for the history books, but the ending to this story doesn't appear to be anywhere in sight, which is why a group of health experts, labor leaders, and community organizers held a very sobering news conference Monday, August 22nd, a virtual event led by the Massachusetts Coalition for Health Equity. The group urges the Baker administration, area universities, schools, and business leaders to implement a comprehensive public health plan to keep Massachusetts residents safe this fall and winter seasons. They urge all of us to take COVID seriously amid warnings from the Centers for Disease Control and to prepare for a predicted resurgence of influenza, which would cause an overwhelming strain on the state's healthcare system going into the fall and winter seasons. You'll recall Massachusetts schools dropped the statewide mask requirement back in February, and the state testing program concluded at the end of the school year. The Coalition of Health Experts asked if mask mandates would be immediately triggered if another surge were to build, because in their words, the state's current position on COVID-19 is certainly not as good as in prior years heading into the fall season. Katie Murphy, who was the president of the Massachusetts Nurses Association, had this to say, and we quote, "We all want our society and our schools open. We all want this pandemic to be over, but wishing it won't make it so, and pretending that we're doing all that needs to be done for the fall and winter seasons and what they may portend isn't acceptable on any level." The coalition called on state governments, school leaders, area officials, and employers to take steps ahead of the fall and winter seasons, urging officials to not hesitate to deploy mask mandates early on if positive COVID numbers begin to spike. Coalition members urged the state to require students or workers who contract COVID to isolate for 10 days or until they no longer test positive on a rapid test, a stark contrast from the latest CDC guidelines, which call for at least 5 days of isolation, followed by masking. ACMi News reached out to Arlington School Superintendent Dr. Elizabeth Holman on August the 22nd, Monday, and she replied back by email the very same day. This is what she said. "We will be following protocols as articulated by the State Department of Elementary and Secondary Education in collaboration with the Mass Department of Public Health, which do not require masking at our schools. We are currently working with the Arlington Health Department on our protocols and recommendations for the upcoming school year, and those will be published to families late this week or early next week. We will continue mitigation strategies tied to adequate ventilation and will, of course, respect the decisions of families or individuals to mask as they wish." Health experts say vaccine and booster shots have marked a significant improvement in protection over the past 2 years when those options either weren't available or were not adopted as widely. Still, nearly 3 years now into this pandemic, we've learned that even the experts can't predict the path of this worldwide virus, and that this fall and winter seasons are still great unknowns, just like they were in recent years. Health experts say we might still be dealing with a BA5, or we might have a BA6, 7, or 8, or we could soon be dealing with an entirely new variant. And here's the proof. It was only one short year ago. No one even heard the word Omicron. For ACMi News, I'm Jeff Barnes.